priority. We see the issues in other countries and things like that. We have to be more concerned with our population's health than money at sometimes.
Welcome back to our special presentation, Opening West Virginia. We're now going to talk about health and the lessons we've learned from the COVID-19 pandemic so far and how they will be put to use in the future. Here to talk about that is WVU Medicine President and CEO Dr. Albert Wright, West Virginia COVID-19 drug czar Clay Marsh, and West Virginia's Nurses Association President Joyce Wilson. Thanks to all of you for being here this evening. I want to start with Dr. Marsh. Where are we, Clay, in terms of getting a handle on this? We know the positive testing numbers continue to drop. We know that the recovery rate continues to rise, and our death rate has sadly gone up slightly. Where are we at overall in this crisis?
Well, Mark, I think that we are doing very well as a state. People have really come together and starved the virus, flattened the curve. Now that we're going from the suppression part, the hammer, as Thomas Puyo says, to the dance, which is us trying to live with the virus and reopen the state of West Virginia, it's going to be even more important for people to pay attention to all of the things that they've learned. And in addition, really consider wearing a mask or a face covering in public, because by protecting ourselves, we protect each other, we protect our health system and the health workers and the frontline workers, and we also protect West Virginia.
Yeah, I think the lesson so far for everyone is don't let your guard down just yet, even though we've had good news. Keep protecting yourself. I want to turn to Albert Wright, the president of WVU Medicine, because this is an interesting question, Dr. Wright, because this is a health question and an economic question. I believe WVU Medicine is now the state's largest employer, but what's been the impact on your health delivery in this state as well as the economic impact?
That's a very good question, Mark. So, you know, we took this very seriously, obviously, as the pandemic started to spread. And WVU Medicine, just like other healthcare systems around the state, shut down a lot of our ambulatory operations, a lot of our non-emergent surgeries in order to do two things. One is to make sure we had room in case we ever had a surge, and try to minimize the number of patients that are going through our facilities. And as Dr. Marsh shared, West Virginia did a spectacular job of stopping a sudden surge. We have kind of a slow flow of patients coming in. We've been able to handle those patients. We've been able to stabilize testing and personal protective equipment, which is now allowing us to start to reopen our hospitals, so that we're, at WVU Medicine, we're probably about 75 to 80% capacity right now in our elective procedures, and other hospitals are doing the same. And, we're constantly growing again, but also saving room in case we ever see a surge or a flow of COVID patients that we need to be able to take care of.
Thank you, Doctor. I want to check in with Joyce Wilson, who is amongst the heroes of this crisis in West Virginia. She's president of the West Virginia Nurses Association, and a lot of people saluting the nurses and other healthcare providers for all the great work you've done. Joyce, when this first started, there was a great deal of concern. Is there enough protective gear, the face masks, hand sanitizer, other equipment, ventilators? Where are we now in terms of getting those things? Do we need to get more, and do the nurses feel adequately protected, and are enough of them themselves being tested?
I think that, I want to reiterate that what the government of West Virginia has done an outstanding job, and I think that West Virginia was slated to be one of the hot spots as far as people dying and needing ventilators because of our unhealthy population, particularly lung disease. But that didn't happen, and the numbers stayed low, and even the number of deaths, as unfortunate as it is, it has stayed low. So the PPE is probably our #1 concern with nurses. Nurses are the ones who spend the most of the time with the patients, and so they are going to be the ones that are going to be impacted more negatively if there's deficits. So most of the places now, I believe, have the PPE that they need, except for some of the things like gowns. Gowns are not available as much as we need. A few months ago, there was a standard for PPE. It was discard after every use, get a new one for every time you enter the same patient's room, or particularly going into another patient's room. And so this time we had to adapt. It was a hard transition for us because it was kind of ingrained in us to protect ourselves and protect the patients. But I do feel like we're getting better with PPE, but I think that some of the areas, we got masks, we've got gloves, but gowns and face shields, probably we need to do a little better. And that's one of the things that we're hoping kind of ingrained in us to protect ourselves and protect, make sure that they have plenty of PPE stockpiled.
All right, so it's a work in progress. Thanks, Joyce. Let's take a viewer question. How do you know how many people have COVID-19 when not everyone has been tested? And when can we all get a test? We'll throw this first to Dr. Wright.
They have plenty of PPE stockpiled.
All right, so it's
test most of the people that are symptomatic or we suspect have COVID at this point in time. We do not have unlimited testing, but our testing has been growing every day. So now we're able to, for example, if somebody's going to come back in for a surgery, we're able to test them pre-operatively to make sure that we're able to keep them safe, keep our staff safe. And at this point in time, we've got enough testing in and around the state to take care of the folks that require COVID testing. We are also starting to advance our capabilities to do what's called antibody testing, where we can check afterward, after the fact, if somebody has been exposed. Sometimes you've been exposed and don't even know it, or we're not symptomatic. So I'm increasingly confident in our capabilities to test folks that we suspect might be COVID positive. And then, as we know, once you have those antibodies, you know, we can safely say that you've had the disease in the past.
I want to have Dr. Clay Marsh answer the same question, but also, Dr. Marsh, what if we, we're opening up business, we're going to get an influx of people here. What if we have a sudden reflash and a big increase in positive cases? Then what do we do?
Well, thanks, Mark. And I think Albert was exactly right with his answer. We're certainly expanding testing, and we know that we need to continue to test the people that are the most likely to die of COVID, the people that are in settings where COVID is most likely to spread. But the governor's been very clear, and I think that it's also clear from almost every other country that has gone through this reopening process, that this next part of what we are facing together is a much more challenging and much more nuanced part. The initial way that we address COVID-19 as a state is we addressed it as a single entity. We all sort of went back and stayed home and separated. And as Albert said, the hospitals did a great job, certainly from the nurses, healthcare workers, incredible courage. And these people are absolutely heroes. But as we go back out again, it's much more nuanced. So instead of focusing on just one entity, West Virginia, we want to start to look at all 55 counties and look at them as individual parts of the whole, and start to look at them as their own sort of rates of positivity that we might see as we reopen, look at border areas, for instance, the Eastern Panhandle with Maryland, Northern Virginia, and D.C. is a particularly active area for COVID. So we need to look now at each individual part and respond very precisely to the problems that exist in that part of West Virginia, and protect that part and then protect West Virginia as a whole.
All right, let's check back in with one of those nurses we've been praising, Joyce Wilson, president of the West Virginia Nurses Association. I kind of want to ask you a speculative question, Joyce. Let's say 6 months from now, this whole crisis is over and COVID-19 is ancient history by then. Looking forward, what does the nursing industry want to see in terms of changes, regulation, legislation? What are some of the lessons learned that we need to fix for the next time something like this happens?
Well, that's a very good question. We have worked very hard with the governor's office and with the Board of Nursing, and of course with the WVNA. There's some restrictions, barriers to practice that we would like to see lifted, that would make it more feasible, especially for nurse practitioners to be able to practice. But also, West Virginia was impacted in a different way for nurses. There were nurses that were actually furloughed because of not doing routine visits or doing elective surgeries. So the nurses on those areas were furloughed. but there were nurses who were working extra hours and extra shifts because they were in a place where they were needed. So we would like to have develop a list of names of nurses who would be willing to cross-train to ICU, to be more prepared if we have a resurgence, or if to go to nursing homes, particularly that's where it seemed to hit in West Virginia, so that they could go to another part of the state and not be losing their work, and not being worried about pay. Nurses are the same as everybody else. They worry about their income and their finances. So I think that's one of the things we'd really like to do, is develop a list of names of nurses who would be willing to cross-train or to go to other places to work.
Joyce, thank you. Another viewer question here, this one from Deborah Chastain, who watches on WOWK. Why is West Virginia using a percentage metric to reopen the entire state versus waiting to have a 14-day decline in statewide cases as recommended by the medical professionals? West Virginia's cases keep increasing daily. There is yet to be a decline. I'm not sure that's maybe an accurate representation of the situation, so let's ask Dr. Marsh to answer that question.
Well, thanks, Mark, and thank you, Joyce, for the question. There's many metrics that go into looking at whether a state's ready to open or not. The Global Health School at Harvard rated West Virginia as only one of 9 states that are ready to open. And the real key for us is not only seeing the really low number of cases like we're seeing, we're one of the lowest in the country at about 2.1% positive tests, but to be able to maintain that under 3% from testing and from the prevalence of disease. Thomas Puyo has written, and this is data from other countries as well, that if you can keep your rate of positivity under 3%, then you can see cases and clusters as they start to activate in a much easier way, because you're not surrounded by so much noise and so much activity like New York City saw, Italy saw, Spain saw. The other thing is we're also watching another measure called the R0, or R sub 0, which is the reproduction number. It really reflects how many people, if you're infected with COVID, how many people are you infecting? And we know as that number is below 1, then the cases are reducing. And so we're watching that very closely day by day. And West Virginia has varied from about 0.74, which is among the best in the country, to about 0.89. And so as we watch that, that's a really early predictor and sensor for what we might see, because the real cases don't happen for about 10 to 14 days, the real impact of that. So we're watching many, many factors, many metrics, but I feel like West Virginia at this point, with the level of care that everyone in the state has taken and the commitment of our citizens, is in as good a shape to open as really any other state in the country, and better than almost everyone. So thank you for that question.
Yeah, good answer, too. And we want to thank Dr. Marsh, Dr. Wright, and Nurse Wilson for their participation. Still to come on Opening West Virginia, it's the big unknown. What does the future hold? We'll take a look at what could be in store in the coming weeks or months for businesses and one of the state's largest industries, tourism. That when we come back.